My name's Dr. Aamena Salar. I'm the clinical lead for modality gynecology. I have been redesigning the way in which we've been delivering women's health, and that process through Vanguard has occurred 6 months in the process of planning, and then we delivered and rolled out the service from October onwards across all of our practices.
So how many patients have you seen since October, do you know?
We're now, well, it's difficult to know. I mean, we run at least now 5 to 6 clinics in a week, of which they're always full. There are about 6 to 8 patients within those clinics. So, you know, we've gone into the hundreds now, I think. So, yeah.
And what kinds of things are you seeing women with?
Everything. So from period problems to pain, issues with intercourse, issues with fertility, problem smears, problems with their urine, waterworks, so lots of things.
And before we were running this service, what would have happened with those patients? Where would they have had to go?
Ordinarily, it depends on the level of skill that the GPs would have had in their own practices. So some of them would be lucky enough that GPs are able to confidently manage some of those conditions to a certain level. If they didn't feel comfortable, they would have been referred on to hospital to be seen in outpatients, to be seen within gynecology services there.
And what's the sort of feedback that you've had from patients? I mean,
by and large, I hope they're absolutely loving it, and so are we delivering it. The reason for that is that they're seen quickly. I mean, our targets are 3 weeks, but they're usually seen well within that, so 2 weeks. We see them in a comfortable setting, you know, so they're outside of the hospital in an environment that is hopefully more relaxing and more convenient, more local. Because of course a lot of these problems are quite intimate, they're very sensitive, and the more comfortable the setting is for the patient, the more at ease they feel, and I think that really has come across. We're quite supportive. Our angle is very much with a GP angle, and in that way we take the time to approach the patient as a whole, to explain things to them clearly, you know, to really empower them with information and choice. I think that's really important. Sometimes it's been quite a difficult journey for them, you know, to get to an opinion or to get to some advice. So it takes a little bit of time to unravel that and handle that element with a bit of care, I think.
Excellent. That's really, really great. So if we were going to say what the priorities are for the next 6 months with the Vanguard work, what do you think is going to happen next?
So, I mean, we have delivered the service to the whole of modality, making sure that we deliver the service to the remaining practices under the ICOF group, and making sure that all the GPs, clinicians know what we're able to deliver for their patients, so they understand the service, to continue to deliver a high quality of care. I'm really passionate about making sure that we keep the standards as they are, and making sure that we see patients as quickly as we've promised, which we hope to do, to expand the team, to bring and upskill other clinicians on board. And the other thing that I'm keen on doing is expanding the service to deliver what patients need. And so there's an element of planning, but when you're delivering a service, you understand actually what those outstanding needs may have been. And so there are a couple of areas that I'm currently working on with the partnerships that we've formed through Vanguard to make sure that we can expand the kind of care that we're able to provide patients. And I think that's what's been brilliant about this whole process, is that me as an individual, I couldn't have done this without the resources that have been available to me through Vanguard, not just the team of managers, but also, you know, the partnerships. And to be able to pool all of that resource makes my life a lot easier. And so really I can make a difference, and I think I'm hoping to bring that out in the next few months as well.
Fantastic, thank you.